Hello, this is a case of TMJ Ankylosis where patient can't open his mouth, which greatly impacts his quality of life by hindering the ability to eat and chew food effectively. The temporomandibular joint is a joint between temporal bone and the condyle of mandible, with one joint located on each side in front of the ears. This joint facilitates essential functions such as opening and closing of mouth, enabling side-to-side and forward movements of the lower jaw, and aiding the activities like chewing, speaking, and swallowing. Ankylosis refers to the abnormal stiffening and loss of mobility in a joint caused by the fusion of bones within the joint structure. In the treatment of TMJ ankylosis, the procedure involves the removal of ankylotic mass followed by the placement of either temporalis muscle or a silicone material in the resulting gap. This surgical intervention is known as gap arthroplasty. Among the different approaches available to access TM joint, my preferred method is alkite Bramley incision, as it provides superior exposure. This technique involves making a precise incision and raising the skin flap anteriorly while exercising caution to avoid damaging the superficial temporal vessels. Following the elevation of skin flap, an oblique incision is made from the tragus parallel to the temporal branch of the facial nerve above the zygomatic arch. Subsequently, using a fine periostal elevator to elevate the muscles from the lateral aspect of the temporomandibular joint. Subsequent to the dissection, two parallel osteotomic cuts are performed to facilitate removal of the ankylosed mass. The ankylotic mass is then gradually excised. Following the complete removal of the ankylosed mass, intraoperative mouth opening is assessed to ensure proper functionality. Afterward, a portion of temporalis muscle is inserted into the gap to prevent re-ankylosis. Subsequently, a number 10 suction drain is positioned and the incision is sutured with 3-0 Mersilk or 3-0 ethylone.
তোর নাম কি?
রোহন আলীরা।
কি অসুবিধা হতো আগে?
আগে হাঁ করার অসুবিধা হতো।
কতটা হাঁ হতো আগে?
আগে বেশি হতো না।
তখন খাওয়া দাওয়া কিভাবে করতিস?
একটু কষ্ট তো খাচ্ছি।
কিভাবে?
ছেলে গেলে একটু কিছু হতো।
এখন হাঁ কতটা হচ্ছে? এখন খাওয়া দাওয়া করতে সুবিধা হচ্ছে? তাহলে ওইভাবে এক্সারসাইজ করে যেতে হবে, একদম নর্মাল হয়ে যাবে পুরোটাই।